Welcome to the Vitality Cast webinar. I'm Dr. Dan Davidson, chiropractor, and your host today. Vitality Cast weekly webinars are sponsored by the Vitality Depot at thevitalitydepot.com. I want to welcome our attendees today. We are pleased to have Junius Ho, the Director of Sales and Marketing from Orthocor Medical today, to talk about a very exciting cutting-edge product called the Orthocor Active Knee System. It's for pain, inflammation, lots of knee conditions. Junius is actually a graduate of MIT, has bachelor's and master's degrees, so he's pretty geeky, which I like. Hey, Junius, welcome to the webinar today. How are you doing?
Great. Thanks a lot for having me here today, Dr. Dan. Really excited to be here.
Well, hey, we're excited to learn more about the Orthocor Active Knee System. I mentioned your MIT degrees. You have been in Silicon Valley. You've worked with Palm. I used to have a Palm years ago. You've also helped launch other things with Electronic Arts and lots of cool things. The reason I bring that up is because this is a very techy product for pain, I guess you could say. I mean, there's a little computer in this thing, and I'm excited to learn more about myself and have you share. Before we get into the heart of the presentation, I know it was exciting just 2 days ago that your product got featured on the Dr. Oz show. Can you tell us a little bit about that?
Yes, so we've had a really exciting past few weeks here at Orthocor. So we're a Minneapolis-based company, but we really hit the national scene on Wednesday with that appearance on the Dr. Oz show. And he basically did an entire segment on PMF, or pulsed electromagnetic field therapy, which is a well-established but not well enough known therapy. It's core to our product, and they showed a few other products as well, and really generated some excitement and buzz and pushed forward this idea and notion that people hearing about new breakthrough technologies should really ask their healthcare practitioners, whether it's an orthopedist, a physician, or a DC, about these technologies that have worked for others, and not to be intimidated or scared because they may not have heard of it. And if you can help yourself, then potentially you can help others down the road.
Well, we appreciate you being on the webinar today. I want to, again, welcome all our attendees. As your presentation goes, if anyone has any questions, please just type them in the sidebar panel in the questions area, and we'll try to address them. So without further ado, Junius, we're going to let you get into the heart of your presentation.
Great. Thank you very much. So again, my name is Junius. I am the Director of Sales and Marketing at Orthocor. You can check us out online. There's the website. We're very excited to be here today with Vitality Depot and Dr. Dan. They are a distributor of our product. So if you have any inquiries following up, you can feel free to contact them or to reach out to us as well. So today I'm going to talk a little bit about knee pain, as well as some of the current treatment options out there. Then we're going to get into the Orthocor Active Knee System and talk about PMF technology, or pulsed electromagnetic field technology, and how that can really help with pain, edema, inflammation, and other ailments, as well as arthritis. So finally, we're going to talk a little bit about the clinical results of PMF. Knee pain is one of the most prevalent chronic and acute injuries that we have here in America today. Over 42 million suffering from it, and over 2 million surgeries each year. So this is a problem that has been around and is only growing with all the baby boomers hitting the age of retirement now. Now, one of the biggest issues with this is that the current treatment options vary from oral pain meds to cortisone injections and surgery, and there really is a huge treatment gap, about 12.5 million patients that really are between a rock and a hard place, where they don't want to continue taking pills. They're looking at a first surgery, or maybe a second or third surgery possibly, and the knee pain has just become something that they really have no solution for. Currently, some of the non-chiropractic treatments out there as we talked about pain pills, injections, surgery. These can be very effective depending on the patient. However, there are the potential side effects and also the potentially high costs of things like surgery, Synvisc injections, etc. Now, what I'm talking about today is the Orthocor option. Now, Orthocor provides our active knee system. It's a product that is a mobile PMF therapy device, a pulsed electromagnetic field, which essentially is a therapy, a fully natural, non-invasive therapy that pushes radio frequency waves directly into the joint to help with post-operative pain, edema, arthritis, strains, sprains. This is actually an FDA-cleared product specifically indicated for these conditions. So you'll see products out there. PMF is actually something that on the internet is quite well known. And the one great thing about our product, well, one of the great things, is that we are FDA cleared specifically for these conditions. We're currently being used in over 100 practices and clinics, and since we are a Minnesota company, that's very kind of locally focused right now. So this is something that we're looking to get out there, raise awareness about, and get on patients nationwide, especially through Vitality Depot. And our Minnesota connections have also allowed us to get in with docs at the Mayo Clinic and Twin Cities Orthopedics. So patients have actually gone here and been prescribed the active knee system. So let me talk a little bit about the technology that we dabbled in the beginning. So what we call it is actually PRT, or pulse resonance therapy. This is our patented version of pulsed electromagnetic field technology. The reason that we have a combined therapy that actually has this PMF as well as heat. So we provide thermal therapy, and both of these really promote that circulation and reduce pain and edema through various means. So you're familiar with heat, you're familiar with cold. We're really talking about the PMF today because that's something that activates the natural anti-inflammatory process. So throughout your body is this energy, all electromagnetic energy from every cell, whether it's soft tissue or bone, to each of the joints. And the ability for the body to reduce pain, reduce edema, all these things is triggered by electromagnetic signals that are communicated between cells. Now, the way that PMF works is to actually activate some of these. So the technology, PMF, has been around, I had mentioned, for 20, 30 years, and it's been used in orthopedic, actually, for things like bone growth stim as well as wound care. So if you go online, check out some non-union fracture therapies, you'll actually see that PMF is used to do that. Now, the way this works at a high level is essentially you have signals being generated by these chips and these coils that are going to communicate to those cells that there's an issue. And depending on the frequency or the intensity of those waves that are being pulsed into the joint or to the bone, it will actually trigger a different response. So our device, the active knee system, is optimized for soft tissue, and that's reducing that pain, reducing that swelling. And the bone growth stim devices will obviously be optimized for bone growth stim. So some of the benefits of this device, the active knee system, are drug-free completely. It's actually very, very easy to use. So this is delivered in the form of a wrap. We often get, oh, is this just a knee brace? Well, it's actually not a knee brace. It provides some kind of compression and support, but it really is not a brace. It's a device and a delivery system. And if you look at the image that you're seeing right now, that's really an internal view. It's an Orthocor inside. So as Dr. Dan mentioned, we have a chip that controls the therapy algorithm. It's a 2-hour therapy for the patients. And you see the presto release, there's a little dock there, and that's actually providing the thermal therapy and initiating the therapy. It's called our orthopod. Now the coils that you see in the greenish orange there, that's actually what's generating the pulsed electromagnetic field. In You can see it's directly on the lateral and medial sides of the joint where a lot of the injuries occur, and that's going to penetrate deep to the source of the injury. So really treating the source of the injury at a cellular level. So a lot of us are familiar with a similar image. This is actually something we kind of generated to talk about the knee spine syndrome. So the kinetic chain is something that we often discuss, and unfortunately not enough patients are aware of, because they'll simply, when they come to see their chiropractor, all they think about is back pain. Well, chiropractors deal in the source of injuries, but whole body as well, not just the back. And this is such a prevalent problem as we've kind of established with the 42 million suffering with this chronic knee pain, that it's very important to balance that entire chain. And if you look at, there's orthotics and there's adjustments and addressing the feet and the back, but one of the critical links, the one right in the middle, the knee, is often overlooked. And that's what we're really trying to help with. So those 57% of patients with DJD, these are people that are going in with lower back pain, but will also be presenting knee pain. And oftentimes that knee pain is the source of the back pain, because they continue to favor whichever side is not injured. So treating that and alleviating that pain and correcting the issues there are really critical to helping with and curing the overall pain that the patients are experiencing. So talking a little bit more about the underlying mechanisms for PMF. So it really is an anti-inflammatory stimulant. So what it's going to do to relieve that pain and edema and potentially increase tensile strength and healing in tissue is what we call promoting that natural anti-inflammatory cascade. So what it will actually do is promote calcium-calmodulin bonding, which creates nitric oxide. And nitric oxide is actually critical to the body's natural anti-inflammatory cascade. So you can see at the chart at the bottom, this is really the process for PMF working and reducing that pain, reducing that edema. So a lot of source of injuries, you'll actually have that edema. And when you don't have that, I personally know this very well. I just tore my quad, and for the longest time, the edema basically seeping down my knee from my quad was causing issues. And actually using this device was able to reduce a lot of that and get me back into rehab much more quickly. So moving on, overall, PMF is not just for knee pain. Our device right now is currently FDA cleared for that, but it's got a wide variety of applications. And I would encourage you after this webinar to go online and read more about it. So some of the interesting, we've talked about bone repair and things like that, but also this has been used for pelvic pain, neurological disorders, and soft tissue repair. So I want to jump into some of the clinical results here. And the first thing that we want to talk about is osteoarthritis pain. So there was a double-blind randomized placebo-controlled study at the Henry Ford Hospital that indicated a 55% reduction in pain scores, the Visual Analog Pain Scale, VAS scores, for a group that were using a PMF device versus a group that had no PMF device. And you can see that this is the treatment time. Initially, in the first 5 days, we actually saw a significant reduction. And this is pretty remarkable in terms of how quickly patients can react to these. So what you're trying to do with PMF is activate the body's natural recovery and anti-inflammatory responses. And depending on the attenuation, the tuning of that frequency to how those cells are going to react, you can get pretty amazing results. And I think that the clinical data speaks to this in this image. So next, in terms of postoperative pain, another indicated use for the active knee system, a similar study showed that the mean score decreased at twice the rate of the sham group. So again, anyone that was in pain using this device was able to get relief much more quickly than the sham group. Now, in terms of reducing edema, this is actually one of the most remarkable things that we have seen. This is, besides the reduction in pain, which is really it should be a quantitative, and in a clinical setting it is, but with a patient it's very qualitative. So do they feel better? Are they able to do things? And that's the one that you really are dependent on the patient. But edema, the reduction in edema, this is something that when you do have an injury, you're able to actually see and visually represent that the fact that there is an increased size in the knee. So in this study, they did PMF on lateral ankle sprains, and they showed that that reduction in swelling from those sprains was 7 times greater when in reducing the volume of that edema. So the speed of that and the effectiveness of that is incredible when you think about it. That's something that you do the resting, icing, the rice compression, elevation, but if you supplement that with this, you're really going to see some potentially amazing results. And that's something that we'll talk about a little bit later. I have an image to show you. But finally, I want to talk about the clinical results of soft tissue repair. And this is actually an animal study, but I put this on here because it's pretty amazing in terms of increasing the tensile strength of an Achilles tendon. So that actually, they showed potentially some tissue regrowth there to provide that additional strength. Now, can't really measure pain, can't really measure those types of qualitative human data points, but that strength they were able to show was significantly improved in rats that were treated with the PMF, or pulse electromagnetic field therapy. So one of the big questions that you probably have now, when can I use the active knee system? Well, as I mentioned before, it's cleared for arthritis, chronic pain, postoperative pain, and edema. So any patient that is had surgery and potentially leading up to surgery as well. So there's going to be that edema. There's going to be that phase when post-injury they're not actually able to have that surgery immediately. If you have an MCL tear, ACL tear, meniscus tear, there's going to be that swelling and pain initially where a patient is going to have to do some rehab or do some resting before they actually jump into that surgery. This can be used for acute injuries as well, sprains and strains, and that's really going to help, as we saw in that study, reduce that edema, reduce that pain, and allow the patient to start the rehab process and start the road to recovery. I should mention a couple of contraindications. So we are contraindicated for active medical implants, such as cardio defibrillators, and as well as continuous glucose monitors, things like that. That really comes from potentially having issues with the energy from the device interfering with the operation of those. So any patient that has those should definitely consult their cardiologist or if it's someone with a glucose monitor, their physician, and of course pregnant women as well. So this is really a complementary treatment to chiropractic. This is something that it's a take-home therapy, and we want you to use this in addition to your adjustments or any PT, active release, any laser, anything used in clinic. This is something that's not going to take away from what you do, because it's something that you send home with the patient, something that they use, and really it's part of their maintenance care and their routine. All too often, people come in, they get their adjustments, they get their treatment, they feel better, but then they just let things run out of maintenance. And this is really built for maximize for patient compliance and to extend the effectiveness of what you do in your clinic. And of course, it saves time, and it should be noted that it will add a revenue stream. This is something that you're able to send home with them, and there is that recurring revenue from the products. So you're able to see more patients, and overall, it's going to help your business. So talking a little bit about the components of the active system. So there's the full kit, and what it comes with is a box of 15 treatments of orthopods, and as mentioned, that is the thermal therapy and PMF activation pod, and it comes in 15 treatments. It provides the heat. They're single use. They're disposables, so they do need to be refilled, and they can come back to your office for that. So it really fits into the whole treatment schedule of, hey, we're going to treat the acute phase, and then we're really going to maintain that afterward. The knee and Orthosource, this is the crux. This is the actual product, and as you can see, it's very well designed, very elegant, so it really fits for any patient. Not going to be an eyesore. They're not going to say, hey, what is that? And finally, an AC charger to recharge the electronics there. So in summary, this is a very unique device, very exciting buzz created nationally by the Dr. Oz show, obviously around PMF, but the benefits are pretty fantastic, and it really is something very easy to use. It's going to help everybody along the chain, from you in terms of saving time and helping patients achieve better outcomes, to patients really getting that pain relief they need to be more active and to really help improve those chronic knee conditions. And yeah, I'll open it up to questions now if there's any. But again, there's the contact information for Orthocor. Check out our website, and any questions about purchasing, etc., you can ask Paladin Depot.
Junius, great presentation. I learn more every time I listen to you. It is a cutting-edge product. Here's a question. What is the suggested typical clinical protocol as far as how many treatments are recommended? Is it daily or, a few times a week? And then how long, is a typical, at least initial treatment protocol? What's the recommendation?
Great. That's a perfect question. I was actually just thinking I should have addressed that in my slides, but thank you to the person asking that question. So this should be used for 2 weeks to begin with, so everyone should go through that full treatment. The reason they should go through that full treatment is, as I mentioned before, different people will react to the PMF differently. So some folks, it may activate in just one session. Others, it may take 5, 6, even up to 2 weeks to actually start getting significant pain relief. After that, this is something that what we've seen is really remarkable. We say as needed after that initial 2-week period, because what people will be doing after they start getting that relief is they're going to be more active. And when they're more active and they're using that joint, it's only going to help keep that pain away. Think about arthritis. The only thing that can actually help improve the condition of the knee, from all the clinical studies and data that we've seen, is actual use of the knee. There's no cure, there's no wrap, there's no device, at least not yet, that's going to help with that. And what we've seen with a lot of our arthritis patients is once they get that relief, they're going to be more active. They're going to walk a little further with their dog. They're going to run more errands. They're going to spend more time outside or doing activities that they like. And that's going to lubricate that joint naturally and help improve the condition of that knee. So after that, it really is, we have folks that are using it once or twice a week. Some don't even need to use it that often. So it really depends on how patients react, as well as how they maintain their lifestyle moving forward. But that 2-week period is what we recommend. They go through consecutive days, and after that, come back for an evaluation and as needed.
Okay, so the initial unit comes with the 15 orthopods, so that would be perfect for daily treatment for up to 2 weeks then, right?
Exactly. So it comes with 15 packs of orthopods. I actually get that question a lot. So you only give an odd number of orthopods? No. So it's 15 packets, and there are 30 total orthopods because each treatment requires one pair of orthopods. So,
Okay. You know, the really cool thing about this is it's portable and wearable. I mean, you're getting therapy while you maintain an active lifestyle. And as you said, that's actually you want people to be moving, be active. And so, and like you said, that's part of the healing process, isn't it?
exactly, exactly. And so the patient compliance is something that we try and strive to improve and make sure we address all the time, because if they're not using it, then it's not going to be helping them. And as far as one of the questions I get a lot asked often is, oh, can this go over clothing? It can go directly on the skin or over clothing. So
Okay.
the PMF is actually going to penetrate through clothing as well. So it really is
Oh,
good
that's great.
for wherever or however you sort of want to use it. Now, the one thing I should mention is that super active folks should not use this when they're exercising, because there are electronics in there, and it really potentially will kind of shorten the lifespan of the product. And so they should definitely, you can use it walking around or running errands or at work, but not playing basketball or running a marathon, those types of
Okay,
things.
so a good walk in the park is no problem. Just not running a marathon, right?
Exactly, exactly.
Okay, here's another question. Uh, what is this more effective for, acute or chronic conditions, or is it, equally effective for both?
Okay. So it is effective for both. What we've seen typically is docs that are trying to see how it will affect their patients. We recommend that you try this on chronic pain. These are the folks that are in the most dire pain. They've been in pain for a while. They've likely tried multiple options or considered multiple options at least. And when they see the results of this device, they're going to be excited, and you're going to be excited, because you're going to start going through your records and looking for people with similar conditions. And as you expand the use and the success of this in your practice, then you're going to have the confidence to say, hey, you have this acute injury. Why don't you try this for a few days and see what happens in terms of reducing any swelling or reducing that pain. I use this, thankfully, right now, no chronic injuries, but any acute injury, the first thing I think about, I play basketball, so I ding my knee quite often, and this is the first thing that I think to use.
Okay, great. You've answered this, I think, in different pieces, but how is this Orthocor active knee system more than just simple pain relief? Kind of a
Yep.
temporary thing, and also how can it be best to be described to patients in that way? In other words, this is just more than just a simple pain relief, but how is it actually helping with the healing, whether it's acute or chronic? If you can kind of piece that together in kind of a simple way to explain it to patients.
Of course. So the active knee system actually works at the cellular level. So those radio waves that are being pulsed directly into the joint, that's actually going to activate the anti-inflammatory and recovery responses that the body naturally will do over time, as long as the people are being active and those cells are firing. Too often, though, especially with chronic pain, that actually doesn't happen. And what this is going to do is kickstart that anti-inflammatory, that recovery response, and allow patients to feel that relief and actually gain the benefits of an actual recovery, because it's working directly at the source, working directly at the cellular level.
Well, and you mentioned even increased tensile strength and, of course, increased mobility, which is going to provide more joint fluids. So, yeah, it's really kind of activating the body's natural healing and recuperative abilities, right?
Yes, yes. So this is something that is going to activate those mechanisms, and depending on the person, you can have some pretty amazing results.
And of course, this is targeted instead of taking maybe an anti-inflammatory medication that is more systemic. Of course, you deal with the side effects. Sounds like the main side effects here is feeling better.
Exactly, exactly. And I think that's a big problem that a lot of people would like to have.
That's true. Those are the best kind of side effects. Well, Junius, thanks again for the great presentation. I know we are going to get some active knee systems for our practice, and we're excited about giving patients that option. I really like your slide about the kinetic chain, and you're absolutely right. We work a lot with foot orthotics, and of course, the main things chiropractors see is so much back pain. But right in the middle there is that knee, and whether it's pronation from fallen arches that causes the knee to shift, and or short leg syndrome, hip misalignment, injuries. It's always interesting that most people, when they need a knee replacement, it's usually one more than the other. And life is a kind of a equal opportunity offender. If it's just life and stress and that, you should have both, but usually it's one more than the other, which usually indicates there's probably some structural component that the knee may be compensating for that may have caused it in the first place, right?
Exactly, exactly. There's imbalance everywhere, and you have to be active about balancing it.
Right. So especially for the chiropractors, I mean, this just is a natural thing to include as far as a therapeutic tool in your office. Again, thank you, Junius. Appreciate the information. He's got the websites there, orthocoremedical.com. Also, thevitalitydepot.com. This is the part of the Vitality Cast webinar series, and you can look for upcoming clinical education webinars as well as access our archives always at vitalitycast.com, including this one. We've recorded this, and it'll be up online very shortly. Junius, thanks again for all the great information today.
Yeah, thanks a lot, Dr. Rand, for having me.
Okay. Thank you all for attending. Have a great day.